we thought we were good, and we weren't sure if we needed to engage in a program that was designed around process improvement. But as we did a walkthrough, we found out, boy, we really can improve, and it's one thing to be good, and it's another thing to be very good.
The NIATx model was so easy to implement. That's what really stood out to me. I think that's what got us on board and kept us on board, is that it didn't become cumbersome, and we can just keep doing it. These little change project, short change cycles, move on to the next.
AMHC has become a lot more flexible in our willingness to try things as a whole agency, and we would not have done that without our engagement with the NIATx effort.
We went from seeing 20 to 25 clients per week, meaning seeing was screening, assessing, and then keeping them for services. After NIATx and through the end of the grant, we are seeing over 100 clients per week now. And we have the capacity. We didn't have to hire any new counselors. We didn't have to use any extra resources. We just had to plan right.
NIATx gave us a strategic advantage because we took additional people who needed services. We were able to provide those services. We received from our funder additional funding, $1.5 million that year. And we found that as our performance improved relative to access to care, our funders had greater confidence in us, and we received more funding.
The future is with performance management and performance funding. And that process improvement is here to stay. We see that in actions by SAMHSA, by CSAT. Everywhere we turn around, we look at continuous improvement, primarily using the NIATx model, in which, in our case, we are wedded to the NIATx model because we think it works.
We're able to demonstrate in applications that we are, process improvement savvy, which is, we're paying attention to data, we're paying attention to outcome and evaluation. And these are all things that I think gives one a lot of leverage in grant applications.
5 years ago, I felt pretty isolated as a counselor, but NIATx has helped us look for solutions outside the field. There's the learning collaboratives, there's mentoring, there's coaching. There's just a connection to the whole country.
We are a long-standing drug and alcohol treatment facility that have overall a pretty strong, stable staff. In our outpatient office, we've seen our staff get more stable. Our staff are happier. They're involved in change team meetings constantly because they have chosen to never stop them. They find them very meaningful. They like to have the input, and so we've never been able to talk them into even taking a break.
Had we not focused on fee collection through the NIATx model when we did, which was 5 years ago, we would have probably lost about a quarter more staff than we lost this year. So we went from collecting 0 fees to collecting, and I'll quote, we collected $929,077.
When I do trainings about NIATx, I tell people that it took a grant for us to realize how much we needed to initiate the process improvement initiatives that NIATx endorses. Now I tell them, you can't afford not to. In this day and age in healthcare, we have to provide more efficient and better quality services, and that's what NIATx has helped us to do.